Good morning, everyone, and welcome to today's webinar presentation on digital support in intimate partner violence care, the iHeal app. My name is Sarah Carsley. I'm an applied public health science specialist at Public Health Ontario, and I have the pleasure of co-moderating today's session. Before we begin, I would like to acknowledge and respect the land, sky, and waters of Ontario, including for their contribution and sharing to support all life within. I acknowledge and respect the treaty, unceded, and traditional territories of all First Nations across these lands and waters. I would like to acknowledge that I am in Toronto, on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. Please join me in acknowledgement and respect of all Indigenous peoples, their life journeys, and worldviews. May their wisdom always guide our own paths forward with open hands, open hearts, and open minds for the mutual success and benefit of all in Ontario. I would now like to introduce my co-moderator for today, Rhonda Britton. Rhonda is a public health leader and manager of the Nurse Family Partnership and Early Years Group Programs team at the Middlesex London Health Unit. In addition to delivering NFP and prenatal community programming, her team is also in the unique position of delivering the iHeal program in the community. Welcome, Rhonda, and I'll pass it over to you.
Thank you, Sarah. I'm thrilled to be here today, co-moderating with you to represent the work of the PHM Prep team in supporting public health nurses, supervisors, managers, and home visiting staff in their work with families. It is now my pleasure to introduce the speaker for today's presentation, Karen Campbell. Karen is an assistant professor in the School of Nursing at York University in Toronto, Ontario. Her program of research focuses on the intersection of women's health with physical and social geography, aiming to improve health and quality of life for women experiencing health inequities across diverse settings, including rural communities and women with episodic disabilities. Karen's clinical background is as a public health nurse. She has experience with HBHC and NFP programs and is currently a member of the iHeal education and research team. Karen, welcome. I'm now going to pass it over to you.
Thank you, Rhonda. It's so great to be here again and to share this work with the public health nurses that are doing this important work across Ontario. So I'm just going to start this presentation by talking about the digital support that we offer in intimate partner violence care, especially around the iHeal app. And there's a QR code here if you would like to if you'd like to take a picture of that, it'll take you to the app. And I'll start just by saying that I'd like to thank all of the research staff, the students, the service providers, our colleagues, the violence survivors who have given generously their time and their expertise to help develop this iHeal app and to refine many versions of it. We're also very grateful for the funding that has supported the creation of the iHeal app, and we wish to acknowledge the Public Health Agency of Canada, Women and Gender Equality or Wage Canada, Western University, and the Canadian Institutes of Health Research. Sarah did a really beautiful land acknowledgement, but we'd also like to share that we work across the spaces that are now called British Columbia, Ontario, and New Brunswick. And we do acknowledge the First Peoples who have stewarded that land, and also our collective obligation to mitigate the ongoing colonial violence against those people and their lands, with special attention to Indigenous women and girls. So just sharing our learning objectives for today. And essentially what I'd like to do is take you through some of the background of iHeal, how it got started, or the iHeal app, and how it works through a trauma and violence informed space. Also to show you how that might work for you in practice and how some nurses have been using it. I won't do a complete walkthrough of the app today, but we'll use some cases just to explore how it could be helpful. And then if you're interested in learning more, we've got some additional resources at the end of the presentation. I'm going to open the chat and enable the chat, but what I'd like to know from you is when you think about the women that you have worked with, those who have experienced intimate partner violence, what's one word that comes to mind about the type of support that they need most? I'll just pause for a moment and just give you space. Beautiful, discreet, compassionate, reliable, safe, empathetic, concrete, like factual and clear, understanding. So reassurance, and I'm not surprised that nurses are using terms like compassionate, understanding and listening, that there's non-judgment involved, trauma-informed and trauma and violence-informed as well. These are great answers. And I think if we let this go, I think you can come up with lots of different types of support that women need. And I'm going to, these are beautiful answers, flexible, trustworthy, believing them, actively listening to them, affirming them. This is fantastic. So women, I think what we can take from this is that women need lots of different types of support. The type of support that they need needs to be something that they can trust, something that they feel comfortable with, and something that recognizes that the trauma that they are going through, that they have gone through, and the trauma that exists in society broadly. This is important that we recognize that there's so many different types of care and support that women need. And when we think about how we came to this work, it comes from a really broad place. So we have a large team, Marilyn Ford Gilbo, who you may have met last month, Susan Jack, who's been on PHN prep webinars before, Colleen Varco, myself, and many others are all part of this team. And we come to this work, some of us for far more than 25 years, not me, but others of us have been doing this for 25 years or more. Most of us are registered nurses. Many of us are also university professors. And like I said, we come from different provinces. We also have very different areas of research that all kind of center around this idea of violence, equity, and health for women, and particularly for women who have experienced violence, particularly intimate partner violence. So what we know is that violence affects many parts of women's lives: safety, health, relationships, economic status or their situation. And those effects can last a really long time, even after separation. We also know that women can experience violence regardless of their background. So those who face systemic barriers and those who experience other inequities in society, like those who are living with disability, rural, Indigenous, those that are younger, that these particular women may even face greater risk and have fewer options to deal with the violence. So the work that we do and the work that needs to be done has to be, like many of you pointed out, inclusive, safe, respectful, and it also needs to attempt to reduce the barriers that women are experiencing. So like you can see here, we've got many different areas where this is all of the research in which we have done research with Indigenous women, research with technology around the longitudinal effects of violence. And I don't think it's on here, but oh, there it is, men's experience of violence as well. So lots of different work that we've done through our team. And some of this might be a review from last month, but what we do know is that in Canada, more than 40% of Canadian women experience violence from an intimate partner at some point in their lifetime, which is such an alarming stat to hear. Every time I say this somewhere, people are surprised, and it is surprising and alarming that there's that high of a rate in Canada. at the most as the most common form of violence against women, intimate partner violence is more than conflict. It's more than that bidirectional fighting or arguing. What intimate partner violence refers to is a pattern of physical, sexual, psychological abuse. Um, any of those, it may be financial, but there's also often a coercive behavior or something that's intended to manipulate, degrade, or control a partner. And that can be from a current partner or from a former partner. Like I mentioned, IPV is experienced from women of all backgrounds. But again, we do think about those that face greater risk and also those that have less options in society to deal with that. Uh, when IPV erodes women's physical, emotional safety at the extreme end, that can be lethal. And in Canada, a woman is killed by her partner every 6 days. But the fallout of IPV extends to other aspects of women's lives as well, into their health, their well-being, their economic situations, their relationships, their families, and to their children. And these effects persist over time. So this can continue long after the woman has left the partner or the partner has left the woman. And it's a complex human rights issue. It's a public health problem that requires action on many levels. So we think about the individual level, the family, the community, the society. This is a global problem as well. And we think about that from needing interventions that are around prevention and also interventions for women that either are or have experienced this. The cost was last estimated in 2009, and that was $7.4 billion annually, the cost in caring for or attending to intimate partner violence issues. And just to put that in perspective, I looked up how much eggs were in 2009, and they were $2.49. So things have changed since then. I'm going to open the chat again and ask you to tell me from your experience, what are some of the barriers that women face in getting support? So as they try to get support, what are some of the barriers that they're experiencing? Shame, stigma, fear. Shame, stigma, fear. Language barriers, absolutely. Transportation issues. The shelters are full, worried about their children if they have any. Financial, housing, having pets. Having pets is actually, that's a fantastic thing to think about as well. It's one of the things that sometimes people aren't thinking about, but pets often can't go to shelters and maybe not go to the shelter that they need to go to. This is a really interesting answer too, that they may not think it's a big deal. They might be in denial, and that's important to think about as well. Concerns about CPS or Children Protection Services being involved. Absolutely. Cultural stigma, nowhere to go. These are fantastic answers, and you'll see that these are right in line with what our research has shared as well. So stigma and shame, and I saw you all saying that as well. These are some of the barriers that women face whenever they try to get support. Or whenever they're realizing that maybe they need it. So stigma and shame, fear of reprisal from their partners, worrying about being judged, and certainly worrying about not being believed. And we saw that in the previous answers that you were all sharing around the type of support they need needs to be something where they do feel trusted, mistrust, a feeling a loss of control, geographical barriers. So they may be living in a space where there isn't services, or they may be living in a space where for example, rural women, where there are services, but those services are run by their neighbor or their husband's best friend. So they may be other reasons there where they're afraid to go. That falls right in line with the desire for privacy and not knowing where to start or what to expect, especially when there's issues around children protective issues, how that information is going to be used in a court in the future. So there are lots of reasons why women are 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 not necessarily wanting to access help, or why they can't access help. But I think it's important to know that 1 in 5 women who have experienced intimate partner violence access violence services. And what this means is that 4 of those women are not accessing services. So what can we do to support those women? Because it's not uncommon that in the healthcare system, and maybe we're a little bit special as public health nurses, but largely in the healthcare system, we refer people off to domestic violence services, which is great because those services have beautiful expertise. But if only 1 in 5 is accessing those services, then we need to address that and fix that issue. One of the things that's happened is the plethora of technology and apps that are coming out. So these resources are becoming available around, all sorts of them are becoming available around lots of health issues, including intimate partner violence. There's actually 2 really good papers that are reviews of apps that have come out, and our app is included in this 2022 paper, I believe. But the research that's coming out is really telling us that these apps can be important and helpful to women because it helps them to give them options to consider what they need at their own time and in their own pace. Mental health apps are also really effective, but they're most effective whenever they're personalized to women's unique concerns, to their unique situations. And we're also really aware that technology can also be used as a vehicle of abuse. So tech facilitated abuse is absolutely on the rise. There can be monitoring of women, humiliating of women. But technology, when it's used carefully and considerately, can actually be really helpful. So coming into where we come into this work, our team's been developing and testing these apps for approximately 10 years now. iHeal app is the 3rd app in a series of apps that we've developed. It draws on more than 20 years of research. I would say closer to 40 years of research, but who's counting? And this includes consultation with women that are experiencing violence and the people that support them, including nurses and other healthcare providers, people in domestic services, and family members and friends. This is a means of mobilizing the knowledge that we do from the research that we have done to make this practical for people. Our first app was called I Can Plan for Safety. It was an adaptation of a safety decision ad that was developed by one of our partners in the US. And we made a couple of changes to some areas, including giving a greater focus on women's health and emotional safety. This was one of 4 apps that was adapted and tested across 4 countries in the United States, Australia, New Zealand, and Canada. We conducted a randomized control trial with 462 women and we compared those women who were using the app with women that were not using a personalized app and had more general information that were helping women with safety planning and health issues. What we did find out was that women in both groups improved their outcomes. But what was really interesting was that the women that were in the app, which had more tailored work within the app, it was more effective for 4 groups. So those that were mothering, those that were experiencing severe violence, those that were living in medium and large cities, and those that were not living with their abusive partner. But one thing that we're really proud of is that the women that used this app said that 95% of them said that they would recommend it to other women. So that was really important for us. They also said that this was a good fit for their needs. And these are some of the comments that we heard from women. And what this showed us was that women who were experiencing the app felt that it was safe, it was non-judgmental, it was powerful, impactful. We also recognize that apps are not a substitute for the high quality services or community support, like what public health nurses are doing in practice, what domestic violence services are doing. But what it is a helpful tool. So something that helps to provide support and information to women so that they can decide what path is right for them. And we really come to this from the space of knowledge is power. It's also a helpful resource for family members or friends who might be providing direct services to, or for those who might be providing direct services to women across a range of different sectors. So the way that the app is being used is varied. Women use it the way that they want to. They can look at it as often as they want. They can return as often as they want, consider different resources at different times. So, as I mentioned, this is the third in a series of apps that we've done, and we really have a commitment to having a public version that's available to women across Canada and at no cost to them, which is part of the reason why we've gone through this this sequence of apps that we've done. So in 2020, we had the first public version of the app hosted on a platform that was licensed in the US. It took a broader approach, more than just safety, and it launched in the early days of COVID. And this was important because during the COVID pandemic, many women faced increased levels of intimate partner violence, and they were also at home more frequently without the support of family, friends, or workplaces. We worked with 8 domestic violence shelters to look at how that app could extend their services. It was live for about a year, and we made a decision to change that just because of some of the licensing and data sovereignty issues. But then in 2022, we were funded by the Public Health Agency of Canada to develop a new made in and Canadian app. This was an opportunity for us to take what we'd learned from the other apps and then structure it for something that made sense for Canadian women. This built on previous apps, and it gave us a sense of structure for Canadian that was specific to Canadian women. So like I said, we built on previous apps, but we did do some new research, consultation with women. And then one of the things that we also did was really take inspiration from a health promotion program for women that were experiencing intimate partner violence called iHeal. So that was also developed by this team, and it's a program that's delivered by community RNs, or public health nurses in Ontario, where it is at the health units where it's done in Ontario. This is one of the few interventions delivered by professionals that has been shown to have long-term benefits for both women's safety and for their health. So that's essentially why we came to this iHeal app. And that was the introduction of our iHeal app. I'm just going to show you a short video. I'm going to show this to you so that hopefully if you are in a space where you need to share this or tell somebody about it or share it with your teams, you can do that. And I'll just ask if you can't hear it just to let me know, and I'll fix that.
Are you worried about whether your relationship is unsafe or unhealthy? Some women are in relationships where they have a feeling something is wrong. Other women have named their relationship as unsafe, unhealthy, toxic, abusive, or violent. Some women have even left their partners, but are still experiencing harms. Most women who have experienced these types of relationships continue to live with the impacts on their health, well-being, and safety. iHeal is an app that can provide you with information, tools, and resources. It's free, available in both English and French, and confidential and safe to use. You can exit quickly at any time. The app can help you think through your own situation and figure out what's best for you. The app is organized into 6 areas that are important to many women. The areas are color-coded to help you find things easily as you go through the app. It addresses all kinds of violence that abusive partners use in relationships and their ongoing impacts on health and well-being. When you've experienced abuse, it can be hard to feel like you're doing anything right. The app can help you see what you're doing well and have more control in your life. Use the app to find a range of options and services tailored to where you live. Start where you want, save what you like. Every woman's situation is different, but you can create a custom set of resources that are right for you. The rest of this video will show how the iHeal app can support women in different situations. If you are in a relationship where something isn't quite right, the app can help you think about what's going on and what is best for you. If that person is still in your life, the app can help you think about your safety and steps you could take to be safer. A lot of women's health problems are caused by the stress of being threatened, isolated, or controlled. The app can help you assess your health and well-being. Use the app to help others understand and take your health problems seriously. If you're concerned about children, the app provides tips and connects you to information and resources. Being exposed to violence affects mothering and children, even if your children haven't seen anything. In any area, you can explore activities, information, topics, and resources. Save what interests you for now or later. If you are looking for support from services, the app will help you get that support on your own terms. Use the app as often as you would like. Your items will be saved, as long as you remember your username and password. You are not alone on your path to being safe and well. iHeal can help you get there. Are you worried?
So that's a brief video that that is available on our website, again, in English and in French. And I actually don't know if that one is actually brand new, so I'm not even sure if that one's up yet, but there are videos there. That one will be up there shortly. But there are videos there that can help you to share with other women so that they can understand what it is, to send to somebody that maybe has sent you a message, but you can't get out to see right away, that other teams may be able to use to understand a little bit about what the app is. So all of that's available on our website, again, in English and in French. I'm going to walk through a little bit about the app and just point out a few features. One of the things that we did was to really think through our trauma and violence informed ways of being, I would say, for most of our team, to come at this with some cultural humility, thinking about harm reduction and equity. And in that, we vetted every single image and every single sentence, every single resource in this app. And there are over 400 resources in the app. We currently have about 14,000 active users on the app, and we really haven't done any broad we haven't done much broad advertising of it yet, for a variety of reasons. One being that it's also an app that we'd like people to feel safe using, but also we want to get it into the hands of the people that need it. So most of our advertising has been coming to people either that work with women through domestic violence, services, or other types of areas like similar to that. We drew on what we learned from our ICANN study, My Plan Canada app, and also with some of the newer literature that's been evolving our work with the iHeal intervention. We wanted to foreground a broad range of concerns. So a lot of times safety gets put as the first thing and the most important thing, and oftentimes other parts of women's health are left behind. And so we really wanted to be mindful about it being more than just safety. So there's decisions that women can choose what parts of the app that they want to use through the framework that's offered in it. We also tried our best to ensure that the app is as inclusive as possible. We have done our best, given our resources, to make sure that that this is as useful as it can be for the people that are working with women and for women. But we do have a commitment from our team to continue this work and to make sure that as we shift it, that we're really thinking about how effective these resources are for women and for those that are using it. This is a screenshot of our website. So our website's ihealapp.ca, and this is often where we would recommend that you send women to download this. If you download this, we do have this available for Android, for iPhones, and as well for a web-based version. Oops, oh my goodness. I touched too many things. So it's available for these three things. If you go to the website and click the buttons from the website, it'll take you right to the app rather than trying to find it in the App Store. So sometimes that's just a little bit easier. Also, there is a web app available for anybody that it may not be safe for them to download this onto their phone. So this is another option that they can do. On the website, you can also find some background information about the app and its development, as well as some contact information for crisis services in each province and territory, and some information about the privacy and safety for the app. And one of the things about privacy and safety for the app is that the username and password is only known to the user, which means that if you lose your password, there's not a forgot my password button where we can tell you what your password was. You would have to sign up with a totally new name and password. And the reason why we do that is because we do not save any information about this at all. We don't have any information. So if somebody fills out a particular activity or does something within the app, we don't have any access to that. We don't save anything. So there's no personal identifiers that are collected or stored. This also means that nobody else can go in and try to guess their apps. I'm pretty sure that my children could probably guess all of my my security questions for probably half of my passwords. So this way, nobody else can get that. It's also hosted on a Canadian server, which means that we've got control and Canadian safety and around where it's saved. And there's a safe use information on there's safe use information that's on the website about how women can use it safety, but there are things like a prominent safety exit, so you can quickly press the quick exit button and get out. It takes women to a Weather Network page, and that's because we wanted to find something that was large enough that it had a quick turnaround time to get there, but also something that was benign enough that somebody could be looking at that site. There's also a safe exit or a fake password. So if somebody is forcing you to put a password in, you can put in 1234. That will again take you to the weather page. The privacy policy on it. So if you go onto the app, it'll ask you to tick off these questions so that people understand what they're getting into and how to use it. But also the actual privacy statement is in really, really plain and simple language. It's not legalese, it's just words that people can understand. When you get into the app, it it's organized through 6 different pillars or areas that align with the iHeal intervention. It starts with a quote. Oh my goodness, I'm so sorry. It starts with a quote at the top, and then there are 6 different areas to explore. These are the main 6 areas. We did put safety first, but any of these women can choose what they want to go into. There's easy navigating buttons, and each pillar is organized the same way. So when you go into each pillar, you'll see that there's a main page and then for things like safety, basic needs, health and well-being, but each one is set up in the same way. As you go in, there's a brief warm-up activity. So each of them have a warm-up activity. How's your safety? How are you doing with your basic needs? Things like healthcare, relationships, finances, and how's your health? So these are just examples. Whenever you go into these warm-up activities, there's just a couple of questions. It maybe takes 1 to 2 minutes max to help orient a woman to what may be in there, but it also includes a tailored message. So based on her answers, the questions reinforce her experience and what she might find helpful within the app. The topics also cover a wide range of issues that fit within that pillar. For example, in basic needs, you might find something around increasing control over your finances. Healthcare is a basic need, resting your mind and body, as well as legal issues. Each area has a little note here, whether it's information or whether there's activities. So each area has at least one activity, but also has a variety of information within it. And each one of these buttons will either take you to another area or will open up into a accordion type folder where you can pick a number of different things. Topics have, like I said, some interactive activities, and those have very specific tailored messages that we designed based on the results of what women are telling us. The danger assessment, I know somebody mentioned before about not knowing if they are in a space of serious abuse, and sometimes the danger assessment is an eye-opener to women that they are maybe more at risk than they thought. But the danger assessment is a risk assessment for serious or lethal violence. There's a safety actions checklist, which will help women try to identify strategies that she may like to try in a safety plan. There's a health symptom checklist that may help her to identify and track health problems that could be related to intimate partner violence. Healthy relationships quizzes to identify the red, yellow, green flags within a relationship, and also shaping your family, an activity where women can think about what are the significant factors that they want their family life to look like. There are, like I said, over 400 resources. We are coming up to renew all of these resources, meaning that we go back in and make sure that all of the hyperlinks are working, that the organizations are still valid, and we have vetted each one of these. We have vetted each one of these to make sure that these are resources that are appropriate for women that have experienced violence. If you have more, please share them with us. We're happy to be updating these annually. The other thing that I was going to mention about this is that when you go into the app, you choose which province you're coming from, and that means that when you do get into these services, you'll be shown anything that is national, like Luke's Place, for example, here is something that maybe we would show to everybody because it has resources that are really available and applicable to people across a broad geographical space. But something like Legal Aid Ontario would only come up for people that are within Ontario. I'd like to take you now through a couple of different scenarios about how you might be using the app. And one of the ways is just for women, to give this to women, to allow them to use it on their own. And this is our example of Janina, who has 2 school-age children. She's living in second-stage housing. She left her abusive partner 9 months ago. He's continuing to stalk her, to harass her. She's regaining some of her energy and is determined to stay separated, but sometimes she's feeling overwhelmed. She's worried about her kids and how to support and protect them. So what might she be interested in? Well, perhaps Janina may download the app, see what it's like. She may not even go in here looking for anything specific, but when she sees the homepage, maybe she notices some of the areas that are of interest to her, maybe around helping her with her children, helping them to to deal with their experiences of witnessing or being aware of the abuse, taking care of herself, and also dealing with stalking. So many women who have children do put their children first and absolutely will make decisions that are around the safety of their children. So she might start with that pillar and going into the family area and to see what's there. She might find that she's interested in the area called caring for children, and there may be topics within that help her to understand how she can support her kids who are dealing and with the violence and reactions to the abuse. So what to expect, how to talk to them about their feelings, and ways that she might even get support would be on there. If she was interested in keeping this, she could absolutely mark that as well. She also might be interested in the Children's Guide to Separation and Divorce. She may not be planning to go back to her partner and may be thinking about custody. So if she searches for custody, she'll also find information that's relevant to those resources as well. Again, Luke's Place is a great resource, and she might find things around family court and beyond in that. Now, if she is interested in saving any of these, she can click on the hearts and that will save it. So later she can hit back into the save button and find that. She might be even interested in taking care of herself and looking at spaces like reclaiming your power. Reclaiming your power is an area that focuses on how women can find comfort and meaning in their life, caring for themselves and putting themselves first. In this section, she might find activities around managing stress, including grounding activities, meditation, brief meditation, videos. I think there's a 2-minute one and maybe a 5-minute one that are also trauma and violence informed. So things like making sure that her back is against the wall, things like that, that help to be very mindful of trauma or abuse that she may have been through. There's also lots of information around stalking. It provides good information that could remind her about what the counselor at the second stage housing has discussed with her, as well as some new ideas for things she can do on her own, like keep track of the times when her partner is harassing her and where to go to get help. And it may help her to feel more confident and controlled. She wants to come back to some of these resources. Again, she can save them and then click on the heart button at the bottom to find those resources. When she goes to that space at the bottom, it will help her to show any of these areas if there's full topics that she saved as well. If she can click specifically on the resources, and you see that down the right side of the screen where those resources are saved. So this helps her to personalize the app with her interests, particularly if there's something maybe she doesn't want to look at now but can later. So those are always open. Another thing that often happens that we've heard is that family and friends are using this app. So this is an example of Taylor who's noticed that their 20-year-old sister is not herself. Previously full of life, she seems down now, complains of pain. She turns down invitations to events and gatherings. She hasn't said anything directly, but they wonder if it has anything to do with their new partner. Something's not quite right, but they don't know how to help. And so in this scenario, somebody might want to look through the app. Taylor might want to try the warm-up activity and answer it as though they are the woman or the sister that maybe that they've and based on things that they've observed. And again, as they go through this, it'll give information about where they might want to go to in the app. And we actually heard from a dad who found this really, really helpful to understand some more about what his daughter was going through. One of my favorite things on the app is the power and control wheel. I like this because it goes through and it actually cycles through each one of these different areas and has in here how this might be applicable to your situation. And again, at the end, just giving a little bit more explanation about what the power and control wheel is and what it means. the health and well-being section may also be really helpful. And again, the dad that I was talking about, he really this was the first time he was able to put together some of the symptoms that his daughter was having, along with some of the symptoms that he found in here. So so this may be really helpful to understand how violence has intersected with a woman's health. There's also an assess your health activity, and it's here that a lot of people actually start to understand some of the health consequences from violence to make that connection. And it could be a good point where you start to talk about, or somebody starts to talk about the health impacts with somebody that they suspect might be experiencing this. Chronic pain is often a symptom that we see from women that have experienced violence, and there's lots of information that's in here as well that could be recommended to somebody that is experiencing pain as a consequence of violence. And the third situation, which might be the most relevant to you, is a public health nurse in the Healthy Babies, Healthy Children program that's been working with Kate. Kate has a 6-month-old baby, and Joanne is helping her. The nurse is helping to manage her postpartum anxiety. Kate's also experiencing some chronic GI upset, and this again is another symptom that we often see as a result of violence. Kate confides that she has a lot of stress. She hates her job. She's afraid to talk to her wife, Alana, who's going through a lot and has some anger issues. Alana also complains that Kate doesn't do enough in the relationship, and she really doesn't want to upset her more. When asked if Alana has ever threatened or harmed her, Kate pauses and then she says yes, but she didn't mean to do it. And I think that this is probably an example or a situation that some of you may have actually experienced. In this scenario, the app allows healthcare providers, or the nurse in this case, to engage in the moment with women in their safety. Embedded in the app are versions of the danger assessment, both the male partner and the female partner. I think that every time that we have done education for the danger assessment, or the DA, when we've done this, there are two things that nurses often maybe feel a little iffy on. And one of them is around scoring. Scoring is just difficult. So I think we can all agree with that. The other thing that sometimes is difficult is when women give us a response that isn't clear cut. It's not a yes or no. So for example, does he have access to a gun, or does he have a gun? And they say, well, he doesn't really have a gun, but his brother has a gun and he's holding the gun. And perhaps it's not clear how to answer that. One of the benefits of doing this with a woman through here is that she can choose the answers, and it kind of forces a yes or no. So that those questions are on here, and the app actually scores it at the end. It doesn't save the score for women. So oftentimes what some of the public health nurses who are using this app and are using the danger assessment, what they've been doing is actually just screenshotting, doing it on their own device or their own work device, and then screenshotting that and then using that for their charting. But it's available both the female, the male versions of it. This is a widely used assessment in violence against women services. The female version has 17 questions that assess women's risk of being severely harmed or killed by a current or former partner. The questions help women to stay safer by identifying risk factors, reducing minimization, denial of the danger, and building support for supportive relationships with helpers. So for Kate, the PHN could use the DA in the app to ask the questions to do this assessment. And I will say that women rarely overestimate their risk. In most cases, women are underestimating their risk, and many of them are actually really surprised to see the outcome of the danger assessment. Another benefit of this is that if they don't want to do the danger assessment, you can show them where it is, and they can still do it on their own. So in addition to the danger assessment, there's other safety activities that are embedded within the app. We've got safety topics. Again, I mentioned the power and control wheel. It's probably one of my favorite parts of the app, just because it's so easy to see the different areas, and there's so many different versions of the power and control wheel that it's sometimes nice just to have one clear one that kind of takes through a variety of more inclusive space. There is specific information on topics around things like safety online, dealing with stalking, sexual assault help, and where appropriate, there's links to other resources and services. And the safety actions activity was the other one that I wanted to mention. And again, you can see those here whenever it says activity or information. And then if you heart these, then later you can come back to them. So in this scenario with the nurse and Kate, the safety actions checklist might be an appropriate next step. This can take the women through thinking about the immediate steps that she's going to take for safety and actions that she can do to improve her safety during this time. In this activities, there's 3 pages that load asking her about her safety, when she's in immediate danger, when thinking about planning to leave, and then safety every day. So she can select any or all that apply. And we've heard from women that just even reading over through the different types of checklist give them an idea on how to improve their immediate safety despite what they're planning on doing. At the end of the activities, again, it gives something that's tailored to the woman, messages that help her to control her direction. And we always need to say that this absolutely does not replace more detailed, more intensive safety planning in any way. The direction that you give to local resources and services or anything like that. This really is a tool to help kick off conversations that you might have with women, particularly women that might be hesitant to have some of these conversations. It's just a different tool to support the work that you're doing, or in spaces where women do not want to have these conversations, something that you can leave with them so that they can continue this on their own. Again, thinking of the barriers that we talked about earlier. Back on the topics page, the public health nurse might want to direct the woman to violence against women services in their area so that there's more of a tailored or specialized support. And there's a brief write-up. All of this is done in as much brevity as we could so that women can quickly get the main points around the information that they need to get. So this again is an accordion style option that allows women to further explore how they might find violence services in their area, etc. So service providers, public health nurses, they use this in many different ways to help women assess their risk, particularly through the danger assessment, to make a plan for safety, even to help women think about how violence is affecting their health. So again, we often immediately go to woman violence. She must be safe. She must leave the relationship. I think just on a societal level, that's often what happens. But we also know that many women don't want to leave their relationships for a variety of reasons, and leaving the relationship can be incredibly unsafe. So we want to make sure that if that is happening, that it's being done in a way that is very mindful of her safety, but also how is she managing just with life in general, with the basic needs of life, with her finances, with her health, with her well-being, the relationships, not just the relationship she's having with the partner, but also relationships with other people. I also really like the area on how to tell your story. Sometimes women overtell and overshare with people, and they do that because they're often not believed. And so having conversations around, or even reading on the app on their own around how to tell and who you might need to tell and what are the consequences of telling your story to some people and why it's being told. Those types of that type of information is also in the app. Exploring resources and services that could be helpful. There again, lots of resources that are available, and each one is tailored per province or territory. Provide an immediate response to women that have identified that they're experiencing violence. And so for women that are on wait lists for services, this again gives them some information right away while they're waiting for that. Provides something for them to use either on their own whenever programs or services end, or if they don't make it into those services at all. It's credible information for information that falls outside of the expertise of the provider. So one of the things that we've heard from nurses is that it's really helpful to get a sense of all of the legal parts, all of the places that normally all of the things that we would normally go to domestic violence services, because that's their expertise. And from the domestic violence services, we heard from them that the health information that nurses are really good with, all of that information was really helpful for them because they didn't know what to do with that. There's a variety of different ways that we recommend to use the app. Again, we have gotten this information from people like you, and I think some of you are actually on the call today that have shared this information with us. But where there's no flags for violence across all settings, one of the things that you can do is to post or share information, stickers or videos that are available on our website. So if you go to our website, there is a app promo button across the top, and you can click on that and download any of the posters in English or in French. And you can use that. One thing you can do is to offer it to all women, to post it in a bathroom or another safe space where women might be, so that you can even just say something like, if you know anybody that's in an unhealthy or an unsafe relationship, please think about sharing this with them. Where there are flags for violence, or you have there's some sort of assessment that you've made where you are thinking that this could be something that happens. In your case, you likely have ongoing contact with them. And if you do have ongoing contact with them, you can use this as part of your care to say, this app could be helpful for you to think about your relationship, and I'd like to walk through some of it with you if you'd like. If you're doing this, I really recommend that you download the app yourself first and go in and play with it as much as you can. Go through the different pillars, find the things that you find are interesting, the things that you might be anyways using in your practice, like the danger assessment or the power and control wheel. Go through and find those so that you know where they are, and it may just be something that you can use with the women, but also something that you can use instead of having papers with you, if that's easier. Where there's episodic contact, so maybe somebody that's dropping into a breastfeeding clinic where you have noticed perhaps something is giving you just that inkling, that feeling, that concern, you can say something like, I'm concerned because of whatever it is. And this app might help you. And in these cases, we also have these cards. So this right here is a front and back of just like a business card, and it doesn't have any other information other than iHealapp.ca on it, as well as the QR code so that it can be scanned for direct access to getting the app. Again, the app is free. It will always be free. We're committed to this being a free app. Also, this is what the poster looks like. And then we also have stickers that are available through us. And if you want access to the stickers, please just reach out to our team. So all of these are available. All the promotional materials are available both in English and in French. And again, on our website, there are introductions and walkthroughs. So those videos are available on the site, and they're available in English and in French. Just want to end by saying thank you. Thank you to all of you that are here today. I appreciate your your willingness to engage in this work. So grateful for what you are doing in practice. We're also grateful to the so many people that contributed to this work, including all of the iHeal nurses that are using this in their work, and other nurses that are using it and have shared their experiences with us, sharing energy, insights, expertise, all working towards change. And this is where you can contact our team, and this is where you can contact me. I'm going to go ahead and stop my share, and I'm going to hand that back to you, Rhonda.
Great. Thank you so much, Karen. I think I can speak for many people on the webinar today that was a really excellent and insightful presentation. You really gave us a great reminder of the barriers that women face in seeking support for IPV, as well as the benefits that the iHeal app can provide. Certainly as someone who has some familiarity with the app, that deep dive was really, really informative. We're now going to move to the Q&A segment of our webinar to answer questions for those of you who are joining us live. As a reminder, if you haven't already, please enter your questions into the Q&A panel. And then with that, we're actually going to begin with our Q&A for you, Karen. Get my questions in front of me here. And there's a couple of questions actually that are related, and you might have spoken to this during your presentation, but just asking if you could share the link to the video that you showed or how to direct people to that link.
Absolutely. And I can drop that even into the chat. The best place to go for the videos is to iHealapp.ca, and on iHealapp.ca, of course, this isn't going to share to everyone. And on iHealapp.ca, you can link right across to the promo, or I think actually it might even be early on, but you can link to any of the videos that are there. And if the one that I showed today isn't posted yet, I'll get that posted so that we can have that there for everybody as well.
Perfect. Thank you, Karen, because I think everybody wants to be able to check that out and use it with their teams as soon as possible.
I'm glad to hear that.
Yeah. Another question has to do with, is the app specifically tailored for women, or is it accessible to support men who are victims of IPV as well?
It's a great question. And the app is evidence informed. I shouldn't say that. The information in the app is informed by the research that we've done. The research that we've done is with women in this app. So the app is tailored to women, meaning that it is informed by evidence that's for women. We also recognize that that men are experiencing violence. One of our team members has quite a large research project at University of New Brunswick around men that are experiencing violence. But I think the app is definitely tailored to women. So the images that we've used, it really is focusing more on women. It's not to say that men's violence isn't a problem, or that in the future we might do something that is more tailored towards men, but this isn't. This is definitely tailored towards women.
Thank you for that answer. Another, I guess, more like a comment than a question. I like how you can switch quickly from being on the app to prevent what the partner might be seeing. And this person is recommending that perhaps it could default to something related to women's health rather than the weather network to make it more in line with the app name, which might draw a less suspicion. So that was just a comment.
I appreciate this comment. And if I can, I'm going to say a few things just about this. One of them is that, because we totally agree, we absolutely fully agree. One of the things around it is that we need a website that has a quick uptake. So I don't know all the techie things because I know all the health things. I'm a nurse, and we know that we work with other people that are doing all the tech stuff, and there has to be something that can quickly load. So, if you load certain pages and it just takes that little bit of a lag, we don't want that to happen. We want something to come up right away so that there's not a lag time. And because of that, we have to use a large, like something like Google or Amazon. And obviously, we didn't want to use something that we wanted to use something that was also in line with the rest of our philosophies and the way that we are. So something like Amazon wouldn't be maybe something that we would choose. Not that there's anything wrong with Amazon, but there is. But so it has to be something that's quick for that. The other thing, so we're quite aware and we're hopeful that something else will come up that is aligned with women's health. This was one of the comments that we got early on from domestic violence shelters as well. Whenever you go on initially, there's a little yellow button that will take you around to show you the app. It will show you where the quick exit is. When you use the app, and you hit the quick exit button, if you hit the back button, it will take you back into the app. So if you're using it on your phone and you hit the quick exit, it will take you to that weather page. If you hit the back and it's on an app, it will take you back into iHeal. And it's just a tech thing. Like there's no other way around that. It is just the way that Android and Apple products are. That's a thing. If you do it on the web, that won't happen. So if you're on the web and you're actually in the app, you're in your profile, you're doing things, and you click the quick exit, it'll take you to the weather page. If somebody tries to back button, it won't work. So I just say that because I want to think about the safety of women that are using this. And if somebody is using it that may be being monitored a little bit more, they might not want to download this app onto their device. And I think that women that are living in experiences of violence are really good at understanding if they may be somebody that should download it or not, but that might be something that you want to bring up with women that are downloading it. Is it safe to download this on your phone?
Thank you. Thank you for that answer. Another question is, do you have any plans to expand to other languages beyond English and French?
We do. So we have it was a lot of work to do English and French, and being thoughtful and mindful about the languages and the subtle variations in what things mean. The next language that people have shown interest in supporting us to develop it in is Farsi. So absolutely, we're interested. And I think it'll just take time, and we are continuing to look for other funding mechanisms so that we can do this work.
Okay, thank you. There's another question related to about recruiting participants. I believe this perhaps means as it relates to using the app itself. And I guess I'll kind of tag on one of my own questions is, does the research team have an ability to know how many times the app's been downloaded?
Yeah, so, and I don't know the answer. I don't know the answer of how many downloads. I do know that there's 14,000 active users right now, across Canada, so across the world, but largely across Canada. We're able to have that information, and the other information that we have is, are people using it for themselves? Are they using it for um, someone else, or are they using it for, I think it's, are you using it for your work or something like that? So we do have a sense of that, and then nothing else. So we don't know when people are in the app. We don't collect any of the data. So if somebody does the danger assessment, we don't know what their score is, for example.
Okay, that's helpful. And then another kind of logistical issue related to the app. You had spoke to the fact that if someone forgot their password, they have to create a new account. And this question has a little bit more, asking a little bit more about that and wondering if they can use their same email address to create a new account, or if they actually have to create and use a new email address in order to do that.
You don't have to use your email to do the account. Like like your password can be anything. So last week I was working with somebody that had their email in as their original password or as original login information, but couldn't remember their password. So they just used the beginning part without the @gmail.com. So they just used that instead. So your password can be anything. Can you duplicate your password? I don't think so. No. So you can't use the same the same login name as somebody else. So you would have to change it. So if you used your email, maybe take off the .com or take off the @ dot whatever, and just use the beginning part of it or change it, add a number to it, something like that.
Which is certainly in line with best practices for passwords, is change it up enough that someone can't guess it.
Yeah, and there's no
Um,
there's no recover questions. So like I said, I'm
okay.
sure, yeah, I'm sure that my kids could get into my bank account by guessing my questions.
And it's good to understand that there's no data stored within the app. I'm just jumping down a little bit lower here in the questions. Given that there's no data stored, is there a way to download or print or retain a copy for the client's own records? Oh, it just moved here. Or transition to a provider they are working with for case notes. So basically considering safety implications while being mindful about future legal evidentiary standards. So is there any way for the client to retain or print or copy information that might
So
be
I'll
beneficial to
I'll see
them?
what some of the nurses that are working with you, Rhonda. So what some of those nurses have been doing is screenshotting on their device and then printing that out and giving that to the woman. Um, the woman can save in. So if she wants to save it, if it's safe to save it in the app, she can save it and then take that and have a discussion with a healthcare provider, like a physician. Um, Around those health issues that are coming up. If it's the DA score, again, it's something that either she can print it out from like a screenshot, but there's essentially not a mechanism to save it, and that is for safety reasons, that's there. So that's what nurses have been doing is using it largely to either doing it on their own device or screenshotting it, having the client share that screenshot with them if the client has done it on their own device. Um, and the other thing that's nice about the danger assessment is that as a woman identifies that her situation is changing, she can redo that activity because we know that those scores don't stay static.
Thank you. Thank you. Yeah, there's a few questions. There's some specific questions related to the app. So I'm going to bring those up first. And then there's a question kind of more broadly, or a couple related to iHeal or intimate partner violence more broadly. As it relates to the app, just quick questions. Of the 14,000 users, have there been any issues that you know of with the app? Yes.
Yeah, no. I'm going to say no. We've not been made aware of any, and I'm assuming by issues you mean any times where it's like come to a safety issue for the woman. Um, and and no, we have not heard anything negative. And like I mentioned, the previous randomized control trial that we did with the I can plan for safety app, uh, again, there's no we've never had any negative issues that way in the 10 years that we've been doing this work.
And then when searching for a resource or service, I noticed that the search queries are for exact matches only. And please try another search term. So I can't necessarily search by city in the search box on the main page. Will this change? So a very specific question.
Yes, and thank you so much. We are aware of this issue as well. So we are working with our tech developers um, to come up with this. If there's something specific, please reach out to our team and say this didn't work, and we'll take that information and try to address those issues. So so for something like Luke's Place, for example, we had to determine what are the indexing terms. So we had to take each one of the 400 resources and then identify maybe legal, maybe children, maybe, and what custody. So what are the different terms that are searchable within that? So they've been indexed that way. Again, they come up provincially, not by city, so that's a good point. And I'm not sure. I'm not sure if that. Yeah, that's a great question, but I will take that back to the team. And so, because I'm not sure if that is supposed to happen. But if not, that's something that we could certainly look at, especially as we're coming into our next round of revisions to the resources. So that's absolutely something that we can look at. And the other thing I was going to say about the resources is just that when you are on a specific page, so for example, the safety area, when you go down to the bottom, there will be some provincial resources that come, provincial or national, if they're relevant across a broader spectrum. Those will come up at the bottom of that screen. So ones that we kind of feel like are probably the most relevant, those will be on those screens.
Thank you. Other question about marketing of the app and appreciating that, you know, there might be some risk to marketing it widely, and that the focus is on healthcare professionals being the marketers of the app. But wondering if there's other ways to share the app more broadly, like general visits to women's health centers, just so to increase that access to the app for those women who might not be meeting with their healthcare provider or accessing resources in the community where they might be, you know, be told about the app.
This is a brilliant question, and if I can also say, this is a brilliant student nurse that is asking this question. So I'm really excited for the next push of public health nurses coming forward, because this is great thinking. So I will. It's not so much that we haven't marketed, or that we're not going to, just that we haven't done that yet. So essentially what we did do was to start with domestic violence workers. So a lot of what we did last year was with domestic violence. So that might have been shelters, it might have been other services that provide support in communities to women. We also are working with nurses, and I think many nurses probably have had some understanding that iHeal app exists, and some are actually using it in practice. Last week, we were also working with some unions and the women's advocates that are working in unions, and it was interesting to hear from them about a previous app for women that were experiencing violence that was like on television, marketed broadly to women so that everybody could know that it exists, so that all women could use it. And one of their concerns was that if that's the case and everybody knows that this is specifically an app for women that are experiencing violence, then is it then safe for somebody to have this on their phone? So we're mindful of that. We're mindful of that balance of sharing it. But absolutely, like, we want this to get into the hands of any woman that feels like she might want to use it, as well as anybody that might be working with a woman that experiences violence. And I always say that if you're working with women, you're working with a woman that has experienced violence, because 40% is a whole lot. We're also very grassroots in sometimes in how we do this. One of our team members watched the movie in theaters, It Ends With Us, and if you watched it, you know that there's domestic violence in that. She did not know that going into it, so she immediately ran out to her card. She got those little business cards, and she stayed at the theater for the rest of the weekend, just handing them out to anybody that watched that movie, and just handing them out. So and I mean, what a great theater that in London that allowed her to be able to do that. So we are absolutely promoting this where we can, and we're also aware that this is a tool that can be used by healthcare providers.
Thank you. Another question related to the app. the person didn't have a chance to go through the app, but I'm curious, how does it include gender fluid people identifying as female? Is that the same as for male in the research gap? So basically, how does the app support those who are gender fluid identifying as female?
Yeah, so we're very mindful about what woman means, and woman means whatever it means to the woman. So, so if somebody's identifying as woman, absolutely, it's intended for them. Um, with the danger assessment, so everything within there, like that was one thing that we did take into mind, that we were mindful of, is the inclusion of woman, and so absolutely, if somebody is identifying, for example, as a trans woman, it is absolutely intended for that woman. I will say with the danger assessments are validated tools, meaning that they've been tested in particular areas. And that is for a male partner and a female partner. So right now there isn't anything that's specific to a trans partner, and I don't know that that would matter if that would still be a female partner and or a male partner, recognizing sex and gender. But those apps are tested, or sorry, those assessments are tested just for that. So you'll notice that it does say, it's one of the few places that will say a male partner or a female partner, because that's what it's tested for. And I think that there's a note on there that says about it may not be as accurate for non-binary partners, but that's not to say that you can't do it. It's just that it hasn't been tested on there.
Yeah.
It'll probably likely still give some good information regardless. They're good questions.
Yes, and the second part of that question had to do with if you have anything to share, is there anything related to two-spirited LGBTQ research?
Great question. So in terms of we come from a place of cultural humility, and we're very mindful of the Indigenous research that we've done. So the iHeal program itself has gone through 2 iterations with Indigenous women, and is currently running in British Columbia an Indigenous Health Center. So our research is informed by Indigenous women. In terms of two-spirited people and other LGBTQ plus, I would say that that we are still working towards how that'll work within the app and how that's being embedded. Again, we're as inclusive and being as mindful as possible with how we included images, the language that we use to be inclusive of those populations as well.
Okay, thank you, Karen. And kind of moving away from the app, can you speak more to the iHeal program itself and how and where it is being used?
Okay, so the iHeal, so the iHeal intervention, is that what we're talking about? Not the
So I think I'm assuming the in-person iHeal intervention.
So the iHeal intervention has been in works for about 40 years, and being tested since 2016. And that's an intervention where community health nurses in 3 different provinces, so in Ontario, in New Brunswick, and in British Columbia, work pretty intensively with women for about 6 months around whatever the woman wants to talk about, whatever the woman wants to work on, around her health, her safety, her well-being, whatever kind of issues come up. So nurses go through quite an intensive training, I would say, and I think some of them are probably on the call and would agree that it's an intensive 5 days of training. Those days are also a big shift in how we typically think about violence in nursing, I think. A big shift in terms of what safety means and what it means to really be woman-led, and just step back from some of our check boxes and be open to truly being in the moment with a woman, having all of the background training and understanding of how women are impacted by violence, and what that means within their life, and how to get them to a good space, a space where they'd like to be, whatever that means for them. And I will say that the program in Ontario is running currently at Southwest Health Unit and at Middlesex London, and it's currently funded by the MCCSS, and there has been a randomized control trial, really positive results. Like I said, it's one of the few interventions that shows long-term benefits for women across a variety of different areas. And there is also an implementation study that is ongoing, so that is funded by the Public Health Agency of Canada.
Yeah, you did an excellent job in a short amount of time summarizing the iHeal program.
I know, I feel like I'm missing out the joy that many nurses feel in doing this, which is such a weird word to use. My mom always says to me, like, are you sure that this is what you want to do? Like, this doesn't sound happy. And I think I would be much more concerned if we weren't doing this work. So I am very privileged to be doing this. And I know that the iHeal nurses give us that same feedback, that they feel the vicarious joy of doing this, not just feeling burnout from systems that we're working within, but also feeling this space of hope. And the iHeal program is hope and future oriented, strength based, and that's the place that we come from.
All of the great things we strive for as public health nurses, definitely. We're getting close to the end. Another question had to do with use of the app with service providers. So if a service provider wants to use the app with a woman, or the woman wants to use the app kind of in an interaction with their service provider, how much of a background in IPV does that service provider need, or how familiar does that service provider need to be with the app?
Great question. And I see another question in there around Children's Aid Society as maybe an example of one of those communities. It has not yet been introduced to Children's Aid Society specifically, but some of them may be on different calls and webinars that we do. So I would say that it would be appropriate for somebody that has very little information about intimate partner violence. Like I said, a dad used it with no understanding, and it really helped to give him insight into his daughter and why she was constantly backing out of family engagements. And I think for some service providers, it may actually help to understand why some women are canceling visits, canceling appointments. And we often know that there's that, 2 strikes and you're out. If you miss 2 visits, you're out of the program. And that can be really, really detrimental to women that are experiencing violence and all of the health effects. So I would say absolutely encourage them to use this with their service providers.
Thank you, Karen. And as we're kind of getting closer to the, just like about 1 minute left here before we're going to start our closing, do you have any kind of parting words or parting advice for nurses who might not have the app yet downloaded, or for kind of to take forward from today's webinar?
Well, please download it. Download it from the website would be one thing I have to say. And thank you for using it would be one thing I have to say. The other thing I would say is that this is not in any way, and will never be, intended to replace the work that's done by public health nurses at PHN Prep, at iHeal. We are all really committed to recognizing the tools that help us to do this work. And so thank you for all of the work that you do. I've been a public health nurse, and I see many of my colleagues on here. I know what it is, and we're doing this just as a tool to help you. And please give us feedback and let us know. And if you want us to come and talk to any of your teams, we're here.
Thank you so much, Karen. And thank you everyone for joining today's webinar. As we wrap up, I want to once again thank you. Thank you, Karen Campbell, for presenting. And of course, all of the details that you shared with us about the app. For everyone attending the presentation today, you can expect to receive a brief and anonymous survey for today's session. Please do try to complete it because it really does help PHN prep with the webinars and supporting the programming. Thank you all and wishing you all just a wonderful day.